Good morning, everybody, or good afternoon. It is 11:02, and we're going to go ahead and get started with our lunch with your legislators here in Southwest Ohio. My name is State Representative Jessica Miranda, and I represent Ohio's 28th House District, which encompasses the city of Forest Park all the way over to the city of Montgomery and everything in between. 13 total municipalities, and my job today is to outline the program very quickly. This is our first Lunch with Your Legislators teletown hall, so bear with us as we get all the kinks out. Everyone is arriving on mute, and that is for a purpose. We have two amazing guests today. One is Dr. Odell Owens, who's going to talk with us about all things public health and the COVID-19 crisis. And then we also have Sally Krisel from the Hamilton County Board of Elections, who's our Deputy Director of Elections down there. And if you have a question at any time throughout the program, please use the chat function in Zoom, or you are more than welcome to put your question into Facebook Live as well. So again, questions, please type them into the chat box on Zoom or into Facebook Live, and we have staff that are monitoring those as well. And let me very quickly go Facebook Live so that we can have that happen. All right. Now I'm going to kick it over to Representative Brigid Kelly, and she's going to highlight some things for you about House Bill 197.
Good morning. Thanks so much to everybody for taking the time to join us. We really appreciate it. So the House met a couple weeks ago in a pretty interesting way where we were socially distanced and meeting in about 8 separate rooms, and folks were voting from the hallway to vote on House Bill 197, which passed unanimously out of both houses. So this is just a quick overview. It's not meant to be an exhaustive summary of the provisions that are in House Bill 197. If you want more details on that, you can visit ohiohouse.gov and look up House Bill 197. But among the provisions of that are, it prohibited water disconnections during the pandemic because we know that this is a challenging time for a lot of folks. Made some changes to ratios for pandemic child care centers in order to keep kids safe. As many of you know and have possibly attended some local government meetings, we did permit them to meet virtually in order to try to keep everyone healthy and safe. Waived state testing and report cards for this year, and made a few other changes to education, and I think there will probably be more changes to education forthcoming. As we know, since we are past tax day, we aligned the tax day for the state of Ohio with the tax day for the feds. So that's now July 15th, not April 15th. And it also extended voting by mail for the March 17th primary election to April 28th. And we're really excited to have Sally Krisel on later to talk some more about that. So again, we really appreciate the chance to chat with you all today, and appreciate your joining us for the virtual town hall. And I believe next up is going to be Representative Ingram from the 32nd District to talk a little bit about the Federal CARES Act.
There we go.
Okay, yeah, thanks you guys, because they had me muted still. This is Representative Catherine Ingram. I'm from the 32nd District. And of course, I was going to talk a little bit about the rest of 197, but 197 is huge. And of course, one of our bigger concerns is the deadlines that are there. And as Rep. Kelly alluded to, we'll talk about the voting piece in the primary, but I want to talk a little bit about what the controlling board did the other day. And the controlling board is a board where there are funds that are appropriated out of the state's budgets. And if additional monies are needed, they have to be released through the controlling board. And one of the things, due to the COVID, the emergency crisis, the Office of Budget and Management requested additional $226 million for a newly created fund called the Ohio Coronavirus Relief Fund. That was done, all of this was done on Monday. And that, of course, makes sure that there's additional monies from the CARES Act that will be able to go out. There's also been an additional $20 million for this year, 20, and next year, 21, from ODJFS for food stamps, because there are more and more people, especially with the unemployment being what it is, and the eligibility for that. We're trying to make sure that people have food. And so that $20 million on top of what was already there is going to make a big difference. There's also, for emergency food distribution, there's $4 million that's been added for this year. This is as of Monday, and an additional $5.5 million for 2021. So as we all know, our food pantries are running low, and there's lots of people that are asking for additional food who have never asked for it before. So those monies will be very important, and that's what the controlling board did on Monday. Fortunately for us, we don't have long lines like they do in some other states where they're waiting thousands of people to get food, but we have considerable issues in the state of Ohio, and so fortunately they're doing that. We also have another $500,000 for the state and county shared services. They need to provide safe and interrupted services during this period of time, and so that was additional. I thought that was important too. Rehab and Corrections has asked for additional monies. I don't think that they're going to be enough, but we'll talk about this, I guess, in the upcoming weeks. But there's $95,000 for emergency medical treatment, as well as $3.4 million to assist in building some of the renovations that need to be done in some of these buildings, which don't address what's happening with the overcrowding with the virus, but we're trying our best to get there. Youth services, another $127 million. So those are things that are there. And so hopefully we'll be able to get to all of this, but it's very extensive. As of right now, we don't know what's going to happen with the school year, but we'll talk about those things in the upcoming weeks. Thank you.
Thank you, Rep. Ingram. All right, Rep. Sedrick Denson is up next.
Good morning, everyone, and thanks so much for joining us. I am State Representative Sedrick Denson from what we call the Fighting 33rd District, and we are certainly all in the fight right now to make sure that we are taking care of all Ohioans. Just want to briefly talk about, so we can get on with our speakers today, how you can stay connected to us throughout this entire process. Of course, social media is going to be a way that you can always look us up and stay connected for daily updates that we'll be putting up as things are coming out. You can also reach us by email, which we're responding to very quickly. And what our email address is rep, R-E-P, and whatever our district number is. So in my case, rep33@ohiohouse.gov. So it's rep, whatever the number of the district is, at ohiohouse.gov. Things are changing daily. We are on calls and work is still being done, and we're doing our best to make sure we're communicating to you daily on things that are going on that you need to know so you can take care of your families, be safe, and understand how we can hopefully get back to a productive, safe Ohio pretty soon. So again, I'm excited you all are here, excited to connect and learn some of your questions so we can be of resource to you. And now we can get on with our speakers. Thank you so much.
Thank you, Rep. Denson. All right, our first speaker of today is Sally Krisel. Sally Krisel is our Deputy Director at the Hamilton County Board of Elections. Sally has been at the BOE since 1999. She's run programs for 9 years for the AFL-CIO. She's also worked on or ran various political campaigns in Cincinnati and also in the state of Iowa, where she worked for U.S. Rep. Tom Harkin and on his Senate campaign in Iowa and for Senator Dick Clark. So Sally, we now turn it over to you, and we thank you so very much again for joining us today.
Thank you. It's really good to be here.
We can hear you. You're good.
Oh, okay. It's good to be here. I'm open to answering any questions. I'll let you know that, as Brigid said, live from the Hamilton County Board of Elections, there are about 60 of us working here to get absentee ballot requests processed and ballots mailed to voters. In the past 22 days, we've mailed about 3,600 ballots each day. And we're way past what we've ever done in terms of capacity and getting materials out to people.
Rep. Kelly, do you have access to her questions? That way we can just get right into it.
Sure. Actually, let's start with this one. So, Sally, we know a lot of people are applying for absentee ballots right now. Can you talk about what are some best practices for making sure that people are filling out their paperwork correctly? And if there are things that folks are doing that might be holding their application up from being processed?
Sure, that's a really good question. What we're seeing, you know, this is a primary election, and a lot of people don't know a primary is where the political parties select their candidates for the general election in November. So a lot of people don't put which party ballot they want. And for this election, you have the choices of Democrat in issues, Republican in issues. In the 1st Congressional District, you have Libertarian in issues, and you have an issues only ballot. So it's really important because people seem to skip that and don't understand. A lot of people think we have an independent status in Ohio, which we do not. And I just want to remind folks too that the ballot that you select is what becomes your party affiliation until the next primary election. So we're doing a lot of time, we're spending a lot of time following up on people about what party ballot they want. I think people should be really careful in filling out the application to make sure that they have all the boxes checked and that they sign the application before they get it back to us, because then it will hold it up and we'll have to send a letter. And of course, you know, we're on a really pretty tight timeline now.
So, Sally, when folks are sending their absentee ballot application, I know that they can print that out via your email or via your website, excuse me, through the Secretary of State's office. How much postage does that take in order to make sure that that gets to you?
Well, the request form is just a regular first-class stamp. We also have a secure 24-hour drop box at the board office here in Norwood. So they can come to 4700 Smith Road and drop it off at the drop box. We also have applications. We have our vestibule open, so applications are available there. People can come in, fill it out, and put it in the drop box inside as well. And then we also have applications at 13 area Kroger stores sitting at the, I guess what would be the customer service desks.
So if I know that we're trying to make sure that folks know that this is a vote by mail election, but there are some folks who may vote in person, but that is a very limited population of people. So could you talk a little bit about that?
Correct. People with qualifying disabilities can vote in our office from 6:30 a.m. to 7:30 p.m. on April 28th, or people who are homeless. Those are the only 2 categories of folks who can come in and actually vote here. And of course, we still urge everyone to vote by mail if they can, because that's the safest thing to do at this point. There's also remote access voting for people with disabilities, and many people in the disability community understand what we mean by remote access. And if you have that on your computer, if you're a blind person and have that kind of ability, you can contact us at 632-7040 and do a ballot by remote.
So, Sally, I'm going to ask you one more question, and then I think we have some questions from the folks who have tuned into the town hall that James Gravely, who is the legislative aide to Representative Sedrick Denson, is going to be asking you as well. And I have also been remiss in noting Kenny Henning, who is the Southwest Ohio Regional Liaison for the Secretary of State's office, is also on the phone, so we appreciate him joining as well. So, Sally, can you talk a little bit about how many mail ballots are normally processed at the Hamilton County Board of Elections versus how many you're processing right now in this mail-only election, in terms of what that means for the folks who are working there, as well as how the various social distancing and safety measures you've taken in order to keep your staff safe have impacted the processing of all of these applications?
Sure. As everyone knows, we didn't have a lot of lead time on this. We would like to know as soon as possible if we're going to do an all-mail election in the fall, because of course having lead time can mean that we can get a lot of things set up in advance. But we basically have processed more this time it's unprecedented than we've done in a presidential in terms of the time period. So like in a 22-day period, 80,000 applications have come in and 80,000 ballots have gone out, and we're receiving trays and trays every day of request forms. So this is really at a presidential level. And then of course those ballots come back and they have to be processed as well. So what we're doing here is we have our staff of 44 with additional 20 people, spacing everybody out 6 feet apart. And of course that delays some of the processing because you have to be very cautious about where you're moving. People are wearing gloves, safety glasses, masks. We have disinfectant everywhere, and chocolate, because elections run on chocolate. And we're very concerned about people here. Of course, we had almost 14,000 people come for the first part of the March 17th election. So there were many people who were exposed to lots of folks early on. Fortunately, we've had nobody test positive for anything here, so we feel very lucky. And we're just gonna try keeping safe, at the same time getting this election over and up and over.
Okay, so I think James Gravely, who's the legislative aide to Rep. Denson, is going to go ahead with our questions that we received both in advance and in the chat. So James, you want to go ahead with that? Or if we can't get James, then I think that I have a list. So Sally, one of the things that you just mentioned was about what we were going to do in case of a mail election in November. Can you just talk about what would we need to do in order to be prepared for a presidential election by mail only?
Well, I think there's a lot of things that would be figured out. Basically, this election, we're able to do follow-up on applications that aren't complete. And so we need to be able to do that in an all-mail election as well. There's just an enormous amount of detail to the application form. So we would want to be able to access voters by email and by phone, which traditionally you cannot do. Knowing as soon as possible for the November election by mail, we would be able to get all of the envelopes and materials that we need in bulk, which we're going to need to do. That was something that we were very fortunate here in Cincinnati, and that we have a printer who could do things for us immediately. But there were also places across Ohio that had to wait to get the number of envelopes and materials that they needed. So knowing as soon as possible for the vote by mail in November for material purposes. And then also you can really start 3 months out from the election in terms of getting your backlog applications together. And then you have almost 2 full months. And like I said, that's a whole lot of time compared to the 22 days that we're at right now.
And so thank you for that. I mean, and so I think that there is a lot of preparation that has to be done in order to really transition a whole election process. And it's something that people are not used to. That they might be voting by mail for the first time this time. So this time, we want to make sure that folks know that it's safe to vote by mail. Everyone is doing it, literally. When are the ballots going to be counted, though? We know, can you talk a little bit about the deadlines? So people, want to make sure they get their ballots in time, want to make sure they turn them back in. And when do we get the news about who's won?
Yeah, and one of the things that you legislators did was do postage paid on the ballots returning. So that's really good. All people have to do is basically vote their ballot, stick it out for the letter carrier, and then it'll come to us. So that's one thing that voters don't have to worry about. Getting it postmarked, we've talked with the post office. Traditionally, ballots with indentias like that don't get canceled, but the post office is making an effort to cancel all of the ballots so we know the dates. So in order to get your ballot here, you need to make sure that it's picked up by your letter carrier before the 27th of April, so that it can get an April 27th mark on it. If you want to drop it by here, we do have the secure 24-hour drop box. Those can be dropped off up until 7:30 p.m. on the 28th. So if you're mailing, get it done before the 27th. If you're dropping it off, before 7:30 on the 28th. Then on the 28th, we will have results reporting, at 8 all night long. They will continue as we continue to process the ballots that come in, but we'll have the bulk of them ready for result probably around 8 o'clock. Will be the first listing. All of the ballots are going to be considered mail ballots, so it's going to be pretty easy as we process. You might know very quickly some good results or bad results, depending on what candidate you are. And then, of course, races that are tight within the individual parties, it's probably going to take a little while longer, maybe through 10 o'clock.
So Sally, I know that there are a lot of people that like to hang out at the Board of Elections on election night when the ballots are counted. What's that going to look like this time?
Well, we are officially closed to the public. We are going to be doing a webinar with the media about how the results are going to be played out. Our board will be meeting next week to determine whether we will have any access in the building or not election night. Again, this is unprecedented territory that we're kind of going into. We will have everything up on our website. We've done all the precautions for that to make sure that everything's going to be accessible on the website. That's votehamiltoncounty.org. And we'll just have to see what recommendations the board says for other types of access.
Hey, sorry, but I want to ask one question myself, and that is, what will disqualify a ballot if the person sends it in? What can go wrong?
Well, on the ballot itself, you have an identification envelope that you must print your name on, and then you must put your ID information, and you must sign it. So those are the 3 key things on that ID envelope. You vote your ballot, put it in an ID envelope, and then that envelope comes down here, and the outside envelope, it goes into the outside envelope. Then the whole package comes here, and we open it up and we start looking at those ID envelopes. So make sure that you put your name on it, sign it, and put your ID information.
Okay, I have somebody who accidentally detached that bottom portion that's perforated that says only the staff should remove. What happens if that was removed?
So any envelope that comes back with both pieces in it, we will accept it.
And if the piece is not in there, say if it's in even if it's in the big envelope instead of the one with the ID. Okay.
Yes.
Just because I didn't want this person to be, because they've done everything else right, and for that little thing to come off and not be counted would be a bad thing.
Sure, we understand there's a lot of people who haven't done this process before, so we're working with people on it.
Good. While I've got you, I want to applaud you too, because I have somebody else who sent theirs in and their birth date was wrong, and the Board of Elections got back to them right away. It was something wrong. They couldn't read it or something. And they got back to them right away and sent them another ballot. So they were appreciative of that. Thank you.
Good. Our staff is doing a great job and under tough circumstances, but they're doing a great job. And voters are being very patient, so that's good.
And Sally, we have one question that came through the chat that says, and it's from Vicky, so thank you, Vicky. I had voted at the Hamilton County Board of Elections prior to coronavirus. Will all in-person ballots be included in the vote count?
Most definitely. We count every ballot. Also, you legislators allowed us to send provisional ballots to voters. These are people who maybe moved and didn't update their address. So we are mailing provisional envelopes, and we'll count those too. We count all absentee, all provisionals. We make every effort to count every vote.
And how about tracking a ballot, Sally? How can folks track their ballots?
So on our website, there is a when you go onto our website, we do have a pop-up that gives information about this particular election that you can access all sorts of information. But then after you remove the pop-up, you can go into another screen that says track your ballot. And you put your name and your information in there, and then you can see where your ballot is, whether it was mailed to you, whether it's been received here, etc.
Sally, with the extended period of time that people have had to vote by mail, what happens if somebody moved either right before the date of the primary election or in between March 17th and April 28th? What should those folks do?
Well, they should still contact us. And we've had some people do that where they moved since they put in their first application and then they put in a second one. And what we do is figure out how to get the ballot to them where they're at and, cancel out the first ballot. And we have a lot of protections that we do to make sure that people don't just get random ballots all over. So we double check and then we send them the correct ballot.
Thank you, Sally. We don't have any new questions on the chat, but if we could, before we just move right into our next speaker, can we quickly summarize where we are right now? Sally, how many days folks have to get their ballot back, postage marks, when they can drop it off, etc., as we close out our wonderful guest from the Hamilton County Board of Elections?
I think we have about 12 more days to get to the election from here. I don't even know without looking at a calendar, to tell you the truth. We have that up on our website. We put it up on our social media, the daily tracking. Reminder that Saturday, I think it's the 25th, is the last time that you can request an absentee ballot. And of course, that doesn't give you enough time for us to mail you a ballot and get it back. The only way you can get a ballot is by mail. So get your requests in before Saturday the 25th, as soon as possible. Respond quickly to the letters that we're sending out to folks who maybe have an error on their application so that we can get it corrected. Or call us when you get that kind of a letter. And that's 632-7000. If you call us and tell us the corrected information over the phone, we can move your ballot for you.
Wow, that's good.
And we've got additional phone bank people working too.
I'm going to interrupt again, if I may. And I just have a question, because we have our regional person on the phone from the Secretary of State's office. How's that going? How's voting going in the state? Can he answer? Or Sally, maybe he's told you.
Kenny, I think you should be unmuted.
Hello, everyone. I'm Kenny.
There he is.
Voting around the state it's going. Like Sally stated, these are numbers that have not ever been seen before for an all-mail election. Some of the other counties, like Warren County and Clark County and Miami County in my region, did have trouble getting the envelopes that they needed for an all-mail election. But we've been able to collaborate with basically boards of elections from around the state to make sure everyone has the supplies they need to get these ballots out to citizens and then so they can vote and return their ballots back to the boards of elections. We did have some smaller, more rural boards of elections already use their security directive funds from 2019 to have some things in place to make this a little smoother, but we did have some counties that had transitioned to paperless systems in 2019. In my Southwest Ohio region, Butler County and Greene County are two counties that in 2019 went from paper systems to paperless systems. So it's been a little more difficult for them to get everything up and running, but luckily these processes were already in place down in Hamilton County. They have a large staff. They've been able to keep a good amount of individuals working down there to keep everything rolling. Some of my more rural boards of elections have not had as much luck getting individuals into work. We have a meeting today at 1 with Clark County because Clark County has to hire 6 more people because they're so short-staffed, and we were able to find 3 individuals from each political party to work and finish up the last 12 days, like Sally was saying. So from around the state, there have been some hiccups, but we've been working really hard with all of our boards just to make sure that the hiccups get resolved the day they're brought to us. And for example, Tuesday, we were asked to reach out to all of our boards and hear any major concerns they had 2 weeks before the deadline so we can get everything addressed within this week. So we've just been working really hard with all the boards of elections, and there's been lots of communications with them so we all know what's going on and what their hard truths are, if you will, so we can address them and get everything resolved.
Thank you. Thank you.
Thank you.
Sorry, thank you, Sally, and thank you, Kenny, both for getting on. And for those folks that had questions, we will be glad to follow up with you after this. Dr. Owens, through the marvel of modern technology, is working on joining us. We did get a few questions for legislators that we were originally going to take at the end, but I think we might do a special feature here in the middle. And so we'll start with a question for Representative Ingram, if she is willing, which is a question about when schools are going to return and how that's going to work when the stay-at-home order is lifted. So if you could talk about, with all of your years of experience on school boards and whatnot, just about sort of checking in your crystal ball and seeing what you think when schools start to go back.
Well, you know, the unfortunate part is, thank you, Rep. Kelly, is that you will need a crystal ball to figure this thing out, because it's not, for some folks, it's not working as well as they thought it would. Remember, these kids are still in school as of right now. They're supposed to be. So there's lots of homework packages for folks that are in rural areas that have gone home, and even kids in our urban areas who may not have internet access. Some parents don't have the car, so they can drive them up to McDonald's parking lot so they'll be able to use the Wi-Fi. So that becomes an issue too, as to what that looks like. We've allowed every year when we go back to school in the fall that there is a summer slide. Well, I call what we have right now and what we're going to have as a COVID slide on top of the summer slide. And who knows what that's going to look like. So I've had educators as well as superintendents, administrators asking us, what are we supposed to do? But these folks are working hard. So the difficulty is that everybody's not in the same place. So the response is not going to be cookie cutter as to what it's going to look like. As of right now, I do have information I just got regarding the College Credit Plus and the college entrance exams and things of that nature that already we're beyond some of those dates. So we're looking at graduating our kids, holding them harmless as far as this virus is concerned. And so though they may not be able to go to prom at prom time and may not be able to go to graduate and walk across the stage, we're trying to make sure that these students are treated fairly. And so the piece about where education is right now, we're not sure. And though the governor is talking about it, I doubt we're going to go back to school at all. And that's me saying that. But I have superintendents who are concerned with what that looks like if they do. And so we've started preparing already with many folks I've talked to for what happens in the fall, the whole list of what ifs.
Thank you, Rep. Ingram. Rep. Denson, we'll do one question for you. So Dr. Owens is going to be on next to talk a little bit about public health, but I think throughout this pandemic, it's really come to light a lot of inequities in the healthcare system that have existed for a long time, but maybe people haven't been as obvious. Some people haven't seen them. Can you talk a little bit about the disparities and where you think we might be able to go on a policy level in order to address some of these very real issues that have existed for a really long time?
Thank you, Rep. Kelly. Yes, we've obviously seen these inequities in the healthcare system for quite a long time, and that's why we're fortunate enough to have organizations like Center for Closing the Health Gap here in Hamilton County, and so many others that pay attention to these things. And what we realized was, and Rep. Ingram was a part of this conversation as well, is as a member of the Ohio Legislative Black Caucus, we started to want to take a look at what the numbers were doing across some of these communities of color and others. So what we did was we pushed for the governor and Dr. Amy Acton to show the data so we could actually see what we were looking at and turn to our experts to actually let us know what this means. And I'm hopeful that if we remain in this state of emergency or we end up having to deal with something, we'll be in a better position to have those experts lead us in a direction to tell us where resources need to be placed so we can actually get ahead of this. That's one of the most important things we can do. So that data was requested and it's coming in and it's given us a better lens to look through so we can make sure that we're protecting all communities and keeping everyone safe, whether that's just having to go out for essential necessities or some people having to go out that are essential workers that have to be in the workplace.
Rep. Kelly, if I may, I just want to comment on that just a little, because what all of this does, if there is any silver lining behind this virus and the shutdown and where we are, is that we have got to take the opportunity to right some of the wrongs that have always existed. And that's in healthcare with the disparities in African Americans and poor and minority folks, period, women, also in small businesses and certain types of small businesses. Here's an opportunity to correct some of what we've done. In education, in the state of Ohio, we need to look at that report card anyway. We need to look at the third grade guarantee anyway. So this virus with the shutdown actually should be giving us an opportunity to do things differently than we should have been doing them all along. Does that make sense?
Absolutely.
That makes a lot of sense. Rep. Miranda, we're going to toss you one more question since you are serving on the Ohio 2020 Task Force, talking about what our pathway forward looks like. So can you just give us a quick update about what's happening with your task force work, when you're meeting, how you're meeting, and the things you've been talking about?
Absolutely. Thank you, Rep. Kelly. So the Ohio 2020 Task Force is actually meeting today at 12:30. So right after we hop off of our virtual town hall, our lunch with legislators here, please feel free to go over to ohiochannel.org and join us there. All meetings are live streamed at ohiochannel.org. We do virtual meetings just like this, where you get to see all of your legislators on the screen. And we're bringing in various presenters from around the state to come and talk to us about, what being in this, pandemic looks like to them, from business owners to State Department folks. And we are really trying to kind of assess the situation where we are now and develop a very comprehensive plan of how we go back to normalcy, whatever that normal will be after COVID-19. So it looks like we have Dr. Owens on now, but 12:30 is the time we have met all this week, all 5 days of the week for the task force. Last week it was at 3:30, so just stay tuned and bear with us. The times may change when we meet, but even if you don't catch us live, you can always watch those meetings back on the Ohio channel.
Thank you for that, Rep. Miranda. We definitely appreciate the update and all the important work that the task force is doing. Dr. Odell Owens is our special guest for our next portion. We really appreciate him joining us today. I have the dubious distinction of introducing him, although I think I could take the rest of this time just to talk about all the incredible things he's done over the course of his career. He's currently the president of Interact for Health, where he joined, President and CEO, of Interact for Health, where he joined in 2016, but prior to that, served as the Hamilton County Coroner, the president of Cincinnati State, the interim health commissioner for the City of Cincinnati Health Department, is a medical doctor and is one of the foremost experts and leaders in terms of IVF and helping people to grow their families, but just has a breadth and depth of experience that is unrivaled by anyone. So Dr. Owens, we really appreciate your joining us today.
Well, thank you. And I appreciate the invitation, appreciate your interest. What I'd like to do is maybe share some things about the coronavirus that maybe you don't really hear over TV, because I think you guys are well informed about the issue. So let me give it sometimes a little bit of a different flair. But let me first start by talking about testing, though, because I think testing is on everybody's mind. Testing is important. The problem is there's only about 3.5 million people receive the test, and there are 349 million people in America. We are so far behind. When we talk about testing, there are two aspects of tests. You can do the regular test, you can do the antibody test. And what we should be pushing now is for the antibody test, especially, and this is even more important, I think, for poor people and people of color, because you're not going to be able to go back to work in certain incidents unless you can demonstrate that you have antibodies to the coronavirus. So I think I talked to a lot of community groups, and they're hollering about testing, and I keep telling them, you're in the wrong line. You got to move from the regular line of doing regular testing to moving over to the line eventually, if they can get enough quality antibody testing. We're not going to have enough. Let's be clear on that. There's a lot of tests out there, but they're junk. They are junk, and they're going to give people some false hope because they're going to have a very high false positive, false negative rate. So be very careful about when people talk about testing, because these tests have not been vetted. There are not enough of them, but they're going to be the key to the kingdom, because I think eventually employers are going to require you to demonstrate that you have protection. Then I want to talk a little bit about the mask. The mask also gives a false security. The mask is not a replacement for sheltered in. I think people think, oh, if I wear a mask and I keep 6 feet, I'm okay. No, that's not necessarily protecting you, because the masks are not used appropriately. The masks mainly are for people who may be affected, so they don't pass it on. The problem is, if you're out and someone sneezes or coughs who doesn't have a mask on, and it gets on your mask, as soon as you return to your car, what's the first thing that people do? They pull their mask off. So they take their hand, pull it off. So you now contaminate your hand, contaminate your seat in your car. You come home, you open your door, you contaminate the door, you walk in, put your keys down, you move around, you lay your mask down on your couch or on the chair. Theoretically, you're supposed to wash that right away. People aren't doing that. The virus can live on copper for 4 hours. It can live on cardboard for 24 to 48 hours. It can live on steel and plastic up to 72 hours. It probably can last in the air for maybe 2 to 10 minutes in a sense, and it depends. But on surfaces, it can live a little longer. So what does that mean? That means that when you go outside and there's a package that the post office delivered, maybe it's best if you leave it outside for a while, especially on a sunny day. Let it stay outside. If you bring it in, then you have to either wear gloves to open that package, take out your content, immediately get rid of that package. But again, if you take that package and you put it in your trash can, and your trash can has a top, you now must go back and sanitize the top of your trash can, everything that you've touched associated with that package. Now, some people are saying even if you get food delivered, you should wipe off your containers. And there are some people that think you should put your containers in a microwave. I'm not sure there's enough science on that just yet. So the mask is a sense of false security, because people don't know how to follow the rules on that, because no one's really teaching them how to do that. I then want to go a little bit more to where have we failed? One of the biggest things is when you start looking at the data from state or even the local level, there's a lot of data missing. We don't have income for certain people. We don't have even race. How do we have a system, especially a medical system, in which people are allowed to send in information requiring someone to get a test and not fill out the appropriate information? That can simply be done. And I think it's one thing, I think as legislators, you need to, when this is over, whatever that appropriate time, to step back and say, what is the process? And how do we have a system where, because even the state of Ohio, when you look at race, there's a big gap in unknown. Even in Cincinnati, there's a big gap in unknown. That is something that we should know. Every physician has that in his office on their records. That is part of the normal medical narrative, the person's age, race, and gender. So there's no excuse for us not to have that. But it also talks about communications, talks about systems. Do we have the right system? Where is Cincinnati communicating with Columbus, and Toledo communicating with Columbus to give all that information? So that's one thing I think you guys need to really look at, and to mandate that the health system has to be able to function where you're not going to process a test or anything else without having the appropriate information. One of the things, again, you guys are interested about the future, but one of the things that we're seeing are some of the more unusual symptoms of the coronavirus. We talk about the cough, we talk about the fever, but there are some people who will present, they now understand, will present with just a loss of smell. All of a sudden, they can't smell things as well. And that's where the virus has gone through the nose and has damaged the hairs in the nose that communicate to the brain. There's also the relationship between coronavirus and maybe some brain impact. And that may be that some people are presenting as if they've had a stroke, there's some confusion, and then some headaches. Now, what does that mean then? If you start having an impact on the brain, you're going to have a certain subset of patients who are going to need long-term care. You're not going to just have a stroke, have some brain problems, and walk out of the hospital. So now, how are you going to handle those patients who have had these complications? That's still going to be another financial burden on the system. Homes, you have to deal with long-term care. People are going to say, oh, I don't necessarily want to bring somebody in who's already had the coronavirus. So there's going to be some discrimination. And what about poor people who may or may not have insurance? So I know it's one of the things you look at in terms of the future. No one's talking about are these people who are going to walk out, who can't walk out of the hospital because of these complications. When we talked about, I'm going to go a little bit back about the importance, a little bit about the sheltered in, because that is the number one. That is the gold standard. If you have a new virus and you do not have any distancing or sheltered in, one person who gets the virus can impact and infect 2.5 people in 5 days. In 30 days, that one person who has the virus would have impacted and caused the virus to be in 406 people in 30 days with no mask, no shelter down, no nothing. If 50%, just 50% of your population would shelter down, do the distancing, then that one person would only impact 1.25 people a day. In 30 days, will only impact 15 people. If 75% of the population simply did distancing, shelter down, then that one person in 5 days would only impact 0.625, and in 30 days, 2.5. 2.5. So even without medication and the vaccination, you can control a certain amount of this by shelter down. And what that really means is that when Trump says, "Oh, I was early and I did things before there was a case," yes, once we knew the possibility that was going to come to the United States, we should have sheltered down in January. We could have had a tremendous impact in January with 2 to 3 weeks of this whole country sheltering down. We wouldn't be in this situation today because we would have sheltered down. Now, still, our biggest issue is not having a vaccination, because there's no immunity in this country, and that's why it's so devastating. In terms of a vaccination, if anybody tells you it's going to take you 5 months, they're not telling the truth. Vaccinations have to be tested, and they normally take anywhere from 18 to 24 months. Even when we talk about medication, and there's no cure for this, in Brazil, they started a drug study looking at chloroquine, which is a medication that's been used for malaria that some people think may help people get better. They stopped the test after 6 days. They were causing so much damage. The problem with a drug study is that normally you have to choose a very low dose, a middle dose, and a high dose, and then decide of those 3 doses which is most effective and causing the fewer side effects. We're right now are rushing in and giving people a very high dose, not knowing the implications. And for most of these medications, it's the heart. But the problem is that when you look at the cases that are more severe, they're going to have underlying medical problems, as you know, and one of them is going to be diabetes, heart disease, respiratory, and even the kidneys. So you're already putting people at risk. So we have to be careful. Again, we talk about we're going to find a drug cure because we're violating all the laws of science in terms of how you introduce a new medication. Now, granted, we've always had compassionate care. That is, if you had a patient, especially with cancer, who was going to die, and you said, well, it's a new drug, it hasn't really been tested, you were allowed to give that to that person because they were going to die anyway, and that was their only hope. But this is a little different. So we have to be careful about pushing or encouraging use of drugs that have not really been tested. So why don't I stop at that point, maybe answer some questions, because I said I wanted to try to give you a little bit of flavor of things that maybe are not being discussed on a daily basis, but you guys are up to speed on those things.
Dr. Owens, thank you so much for that. We've learned so much. I feel like this update that we just got has kind of covered everything, and certainly some things that I have not heard yet. So certainly thank you for that. Wanted to take the last few minutes, because I know we want to be respectful of everyone's time, to dive into some of the questions that we're getting. I want to go to one that came through our Facebook Live from folks joining in. And one of our listeners said that he's heard that people have gotten the COVID-19 and recovered without ever knowing it. Has anyone else heard that this is true? Can you speak to that?
Yes, we know that very early on that 25% of people who have encountered the virus are asymptomatic. They're without symptoms. That's the danger group. That's the danger group. And that was a concern of why you have separated your grandchildren from the grandparents, because the kids can get it. And it seems with this virus, they can handle it better. The regular virus that you and I get our vaccinations on is just flipped. Normally, it tends to have more of a devastating effect upon young kids. This one is on the older patients. So yes, we know 25% of people, in fact, the stuff coming out of China says there are people who only had a loss of smell, and yet their antibodies were positive for the disease.
Thank you for that. And sort of a segue into another question that we got when we talk about that older population, even as I personally think about my grandmother and me having a child and the separation you talked about, the grandparents and the grandchildren, will reentry into the community once we get back to what we think is normal, have different plans for those over the age of 65.
Well, I think that's the last group that you would encourage to get back to whatever the normal is going to be. That's the last group, and when we look at what's the normal going to be, well, are movie theaters still going to be around? People now at home, they're comfortable with watching their programs over TV. So people 65 won't be rushing to go to movie theaters. I think they're going to still be very cautious about going to grocery stores, because it's still going to be a risk. There isn't going to be a day where we say, oh, we flipped the switch and the coronavirus is gone. Why? Because people will travel into this country. People will travel out of New York. People are going to travel out of Florida. People will travel from other hotspots. Just like the regular flu, we all of us have had friends that have had the flu in May and June. So why do we think this is going to be any different? It won't be.
Right. One thing I know that because of your work, you sit on a lot of different panels and probably a lot of calls during this time with a lot of different experts from all of the health community. Can you talk about if the topic has come up with our disabled community and healthcare rationing? Is that a topic that you're hearing being discussed a lot of?
No, and that's very interesting. I have not heard. The only time I've heard about the people with disabilities come up, quite frankly, has been that they're allowed to join the older people and go into grocery stores, the first 2 hours of a day in those stores. But haven't anybody talked about that? Healthcare rationing, really haven't seen that. In Cincinnati, we're fortunate because, the Cincinnati Health Department runs 6 health centers. So people can get health care in Cincinnati with or without insurance through the health department. They cannot turn away anyone. One of the things, though, however, is that the pandemic will expose a given country's treatment of the poor. And so now when we say health treatment, I'll go back to testing. When you have these drive-up centers, many of the people in our community don't have a car. How do they drive up? And they won't allow them to walk up. And so poor people are, and as we look at the data, we know the poor people are adversely affected. We know the race and income makes a difference, but we shouldn't be surprised on that. When you look at someone who lives on Hawaiian Terrace, big housing project here in Cincinnati, if one person gets impacted, they can't go home and isolate. They go home to what? Grandmother's there, mother, 3 or 4 kids, maybe a sister living there. They don't have the resources to even get the masks or to do some of the other things.
Right. Well, I certainly want to thank you. We are coming up on our time, but I hope you and your family are staying safe. I know that's extremely important, and thank you for sharing so much of what, again, this is some information I'm hearing for the first time. So it's extremely helpful to myself as a legislator and our listening audience. But if we were to just summarize some things that you could just say as you're going out and moving about, just some key things to keep in mind about how we're dealing this versus some things that we're hearing, as you talked about earlier, what would you summarize as maybe 3 top points to make sure that we're doing when we're moving about, leaving out of the house when we have to?
Right, and that's number 1. Leave only when you really, really have to. 2, you have to protect yourself. Yes, if you're going to go out, I mean, I'm not a big fan of the mask, but you're going to have to do something. And I'm going to leave with my tagline: stay home, stay healthy, stay alive.
I appreciate that. As we say in my church sometime, govern yourselves accordingly. So hopefully that's something that everybody is doing. And again, thank you. We are so lucky to have you in Hamilton County. Thank you for
yeah,
sharing.
appreciate that.
It's extremely important. So thanks a lot. I'm going to turn it back over to Rep. Miranda.
Thank you, Dr. Owens. All right, we are now at 11:58 a.m. My fellow legislators, did we want to take a few more questions? Does James have any questions queued up before we close out here? I see really quickly someone asked, will you be able to watch this again later? We are Facebook Live right now, so you will be able to access this on Facebook.
It said it's being recorded, so yeah, they'll be able to see it.
Yep, so you'll be able to see that at a later time. All right, James, you got anything if you can hear us?
Yeah, I don't really have anything. Dr. Owens covered most everything. Give me 1 second. A general question for the members. Can you address the folks that want the state to open immediately and completely?
How do you rationalize that? I mean, it immediately means, okay, we're good. You turn on the faucet. There's no way in the world we can do that. And I'm even skeptical of the phases. So let's see what happens, because May 1st is going to be here before you know it. And let's see how much work gets done prior to that time with that rollout, because businesses are touting for themselves to be essential, and I get it. The governor is being pushed to open up as soon as possible. The economy is crazy, and just like JFSJ, the Jobs and Family Services has run out of money already for unemployment. We got to figure that out, whether we use rainy day money or what, because opening up right away is going to be crazy. You can't do it all at once. It would make no sense.
Thank you, James. Thank you, Rep. Ingram. And again, as Rep. Denson mentioned earlier, we do want to be respectful of everyone's time. So the time is now noon. I just want to thank you once again for joining us today. We hope you got a bite to eat while listening to us and our wonderful special guests. And a huge thank you to Sally Krisel from the Board of Elections and Dr. Odell Owens for those wonderful presentations. Our next lunch with your legislators will be held Friday, April 24th, same time, 11 a.m. We will send out a link to register. We do encourage you to register. You can send in questions on the function of registering as well. And the topic next Friday will be all things small businesses, resources, and some additional special guests. So please join us then. And we hope you stay safe, stay well, and have a wonderful weekend. Thank you, everybody.
Thanks.